Hello, my name is Alaa Hamed. I'm the Global Head of Medical for Rare Diseases at Sanofi. It's great to be back at World this year with an amazing data and amazing platform presentations. This year at World we have over 40 abstracts and we have multiple symposia that cover everything from diagnostic odyssey, artificial intelligence, all the way to the ecosystem and how multi-stakeholder dialogue should happen to improve the care of patients with rare diseases. We are especially proud with our real-world data this year. We have multiple analyses that are coming from our registries in Fabry, Pompa, and Gaucher, and it's really moving the needle on evidence and leveraging real-world data. The importance of registry is as you know, rare disease is rare, and we need data from multiple sources, and the registry it houses this data from multiple centers around the world, so it's a global data set. It allows us to monitor over time, and it allows us to further understand the diseases. When the products get approved, we have minimal knowledge of the disease spaces, and part of the following up of patients over time that allow us to understand the progression and poses new research questions for us to tackle. And so that's the value for the registry for us. The data from the clinical trial is data in a controlled setting, usually a randomized controlled setting, and it allows us to specifically, it's more like a lab exercise, as much as possible that you can look at information in a very controlled setting and look at few variables that you change over time. While the real world data is actual practice in the real world. So once the product is approved based on the data, the package from the clinical evidence, the real world data allows us to monitor the product over time and opens up other questions and allows us to see how the effect in the real world setting, because also the patient population is more diverse in the real world setting, and the practice is also more diverse across the world in the real world setting, as opposed to the very controlled protocol of a clinical trial. I think, as I mentioned earlier, it moves the needle on understanding the conditions that we study in several aspects. Differences between pediatric populations and adult population, different practice pattern of medicine switching data. It also looks at comorbid conditions, Parkinson's disease, for example. So it's a holistic data set that looks at multiple aspects, and each condition have different questions, and these data set help answer those questions. I think it's more stronger, and the commitment manifests itself in focusing also on patient-reported outcomes, how to work on models for developing data where the patient is the center of the data generation, not just the company is designing the study. So that approach is something we're integrating now, both in our clinical trial designs, but also in our registries, in kind of adding directly to the registry patient-reported outcome, having patient advisors on the registries across all our registries, so that kind of co-creation with the patient community, the next wave of evidence. We're most excited that we continue to be very committed to the patient community, and our commitment manifests itself in what we do, whether in new analysis, whether it's innovation around AI and finding a diagnostic algorithm, whether it's looking at potential remote monitoring. So that's what excites me, is that we are 30 years plus, we are still innovating, and we're still committed to the rare disease community.